Now, students at Edge Hill University have created new video guides to encourage more patients with learning disabilities to take up health screening. Research has found that for some people, a trip to the doctors can be incredibly intimidating, especially for intimate procedures like smear tests, breast exams and prostate checkups. Georgia Wood is a film student at Edge Hill University, and Maggi Bradley is an honorary lecturer and practice nurse, and also the nurse lead for Sefton Training Hub. We're going to start with you, Maggi. Maggi, what a great idea. How did this come about?
Good morning. It came about after a conversation with a GP and her trainees, and they were going to be struggling with how to get this information across to patients that might need these procedures in the practice. And then as we do joint learning sessions, you see, so we had our learning disability student nurses there, and they came up with the idea of or somehow simulating the actual procedures that might really take some of the fear and anxiety away in that particular group of patients, and really, really simplify the message we were trying to get across.
So which procedures are you talking about within the film? I mentioned, breast and prostate and smear tests. Is it that and more?
Yeah, there are three videos. There's breast examination, vaginal examination and rectal examination, as you alluded to. And they're probably the three most intimate, common procedures that patients would have to undergo in a GP setting. So that's why they were the ones that obviously came to the GP's mind as the most difficult to be able to translate to a patient.
And is research showing that patients with learning disabilities are not taken up as they should be then?
Yeah, research definitely shows that. But apart from that, just imagine being in that room when the doctor says, I need to do a rectal examination or I need to do a vaginal examination. You and I would understand that perfectly easily, probably with a little bit more explanation. But for somebody with a learning disability, that could be absolutely terrifying, even as much as the fact of, get on the bed and turn on your left side or whatever. So we broke the procedures down into step by step, and I'm sure Georgia will tell you this, and really broke them down so that they knew what was coming at every stage. That's the thing. You've got to engage with patients, and the only way to do it for this particular group is to think outside the box, because they don't receive information as you or I would.
Right. Georgia, you directed the videos. Tell us about it. Maggi was just saying there that it's really been broken down step by step.
Yes, so we wanted to make sure that patients with learning difficulties would get exactly what they were supposed to with the videos. So, like Maggi was alluding to, we did just strip everything back when it came to every single procedure. So students, not just students, but younger people that have learning disabilities will be able to completely understand it, and it takes that fear away. And as I feel like we can all relate to that fear of the unknown.
Absolutely.
And there's not that much information really that goes into it. There's leaflets that get handed to patients, but that's kind of it. And it kind of comes just back to the patient's interpretation of it, which obviously we cannot predict. So if a patient got shown those videos, they can go, okay, this is what I'm doing. I don't need to, it takes that fear away. Like, I don't need to worry about this anymore, type of thing.
And tell us what kind of feedback you've had from people watching it.
I've had really good feedback thus far. It has seemed like a very empowering experience to be a part of. I remember we did an initial pitch meeting where I spoke to Maggi in person for the first time, and it really showed how important this project was, because initially I didn't know what this project was going to be at all, or I didn't realize how big it was going to be. But when I had that meeting, I was like, wow, this is really important. This is really important for so many people.
It really is. Maggi, tell us about the ways that you can access this video.
Yeah, so this video, it can be used all across Sefton, so right across the Sefton patch, Southport and Formby, and Crosby, Bootle all along. And you can access it by excuse me, you can access it by going to your GP surgery. And when you see the GP, they should be able to, if you need one of these examinations, they will be able to show you the procedure while you're there in the surgery and break it down for you. We've also used it as a bit of teaching for other students, other learning disability students and other practice nurses, to be honest, as well, because the value of student nurses is that they educate us nurses that have been in the profession for a long time, and they bring us up to date. And having a learning disability student nurse just opens your eyes totally to a different way of thinking and a different way of working, to be able to capture and deliver your services to that particular group that maybe don't receive information in the same way as other people do.
And I think it's okay for us to highlight at this point, and you'll guide me on this being a practice nurse, that if somebody is having a GP appointment and they're said, oh, we need to do a rectal examination, that it's okay for the person who's with them to say, okay, that's great, but can we just delay it until we can go home and watch this video? It's all right to do that.
Absolutely, yeah. And that's what we would encourage, because that's the bit that go take the fear away, isn't it? Once you've seen the video, you can digest the information, you can perhaps ask any questions that you need to. Then, yeah, absolutely. If that's what the person wants, yeah, that's definitely what we'd encourage them to do.
Maggie, I'm wondering when you sleep, because your title that I gave you at the beginning, an honorary lecturer, a practice nurse, and also the nurse lead for Sefton Training Hub, that's a lot going on.
Yeah, but it's the best job in the world, isn't it? Because I'm with other nurses, and I'm with student nurses of many disciplines, and it really is the best job in the world, because they keep you going, they inspire you for the future, and they really, really make a difference to the patient group that you're looking after. So yeah, it's a lot, but it's so worth it, and it is the best job.
And you're still finding students coming through that are still so passionate about it.
Oh, yeah, absolutely. We have 9 at the moment with us. So we have some learning disability, mental health, adult, nurse paramedics as well. It's growing and growing all the time. Yeah, they're coming, and they're more and more enthusiastic with every cohort that we get. So we just push and we just develop different things with each cohort. So it's fabulous.
Thank you so much for talking to us. Georgia, what year are you in?
I'm actually in my final year. Hopefully might do a master's degree, but at the moment it's just completing my Bachelor of Honours degree at Edgehill at the moment.
Oh, congratulations on getting through to your 3rd year and on making such a useful film. And thank you for speaking to us. Georgia Wood, film student at Edgehill University, and Maggi Bradley, honorary lecturer and practice nurse, and also nurse lead for Sefton Training Hub. Good to talk to you. So don't forget, if you are referred for any of those tests and you have somebody with a learning disability that you think would benefit from it, do ask your GP about access to those videos, because we're absolutely sure it will help to break down those barriers and fears.